Healthcare brands need to fight the urge to stay quiet. I think there's so much volatility, there's disillusionment. And so, in a very risk averse industry, there is this sort of default to let's say as little as we can and see where this goes. We need the brands to increasingly pull through as credible, as trusted, as having people and patients' best interest in mind. And that's not an easy thing to do, especially in an environment right now where healthcare is being very politicized. I do believe those that are proactive right now will emerge as the leaders and come out the other side of this transformation in the best possible position.
What I really want you is to make introduction. Who are you? What's your role? What you do? What's your perspective? How did you get where you get? I know so much about you at this point in time, but please introduce yourself. Thank you.
Yeah, thank you, Ben. So my name is Ryan Lilly. I'm the managing director of MWW Health, which is the dedicated healthcare division within Mike Worldwide, which is one of the largest privately held PR and communications firms on the planet. I have spent my whole career in agencies always focused in healthcare. And I have really spent the last 15 years very intentionally working across the entire continuum of healthcare. So working with hospitals and health systems, working with insurers, working with technology companies, pharma, biotech, consumer health and wellness. And I've been very intentional about those verticals are increasingly interconnected. They're collaborating, they're partnering, they're thinking increasingly about patients and consumers. So my perspective is really grounded in deep healthcare knowledge, really across the care continuum, always with an eye towards reputation, brand credibility, brand awareness, and how can the communications function, support the business, but also, in many cases, what they're trying to do for patients and for people, which generally is take care of them.
So we spoke about a number of different things. I'm very keen on one of the statements that you made, and that is how to shift. I mean, with so much knowledge and weight on what you really do and understand healthcare, how to shift. And these are this hypothesis, how to shift from sick care, which we are experiencing right now in the United States. We don't need to explain these, to value-based care. Healthcare brand must rebuild trust, rebuild the trust through trust, transparency, and all the good values that we are about to discuss now.
Yeah. Healthcare, really globally, but certainly in the United States, is in the midst of a really massive transformation. Things in healthcare take a while. It doesn't change fast. But I would say we've been sort of on this value-based care path for many years now. I think the pandemic sort of interrupted progress, but now we're getting back to this way of thinking. And what value-based care really means and what the shift is away from episodic, sort of responsive sick care. So right now, you get sick, you go see your doctor, they prescribe something, they give you a therapy, a recommendation, and it's reactive once you are already sick. And it happens in moments, it's not highly coordinated. Value-based care is really about shifting towards greater focus on outcomes, not just run the test, prescribe the thing. Are we making this patient better? And that has implications, obviously, for the patient, but also for doctors or insurers. How do we pay for this model? What data is needed to prove out the value of value-based care? What data is needed to define value-based care? Value may mean one thing to a doctor, another to an insurer, another to a patient. But generally, this seems to be the direction that we're going, and in my opinion, it is the right direction to be heading.
So this is really introduction. This is hypothesis that we both like to talk about, and it will guide us. We're going down to the rabbit hole right now.
Sure.
I just want to ask sub question: what? Because we are both in branding, that's what we do basically. It comes down to that point. What is the new role of the brands in this new world that you're proposing?
Yeah, it's a great question, particularly this moment in time here in the United States. And I think between the political environment and also just growing disillusion or distrust in our health system. So we had this horrible situation where the CEO of one of the biggest health insurers in the country is murdered. And a large part of the population celebrated that. And to me, that is encapsulates the level of disillusion or distrust that is happening with a large segment of the population, right? So I think brands need to really focus on instilling trust, reestablishing themselves as more than money machines, a transactional care providers, whether you're a payer or a hospital or a health system or a physician. We need the brands to increasingly pull through as credible, as trusted, as having people and patients' best interest in mind. And that's not an easy thing to do, especially in an environment right now where healthcare is being very politicized and what is true and what is science. And not long ago, Tylenol was maybe causing autism. It seems to now be safe again. If you think about Tylenol and the role of their brand and how they navigated that, it's incredibly complex. But I think most importantly, right now in the United States, healthcare brands need to fight the urge to stay quiet. I think there's so much volatility, there's disillusionment. And so, in a very risk averse industry, there is this sort of default to let's say as little as we can and see where this goes. I think that's a major shift in thinking that has to happen at the brand and communications level across healthcare. And you do that by telling stories that are data driven, evidence backed, stories that are human in nature. If we're talking about insurance reform and cuts to Medicaid, right now we're dealing with cuts to SNAP, food, nutrition benefits. Can we tell stories that are data backed? How important nutrition is to health and wellness? Can we tell stories about the kids that now for Thanksgiving may not have a turkey on the table if they even have dinner tonight? Those are emotional. They're also based in fact and have real implications at the system level in terms of patient outcomes, but also cost. People that don't eat well, that are in difficult socioeconomic situations, data has proven that they deal with more chronic conditions. They end up in more acute settings where they're at the ER requiring very expensive care because there's a lack of sort of whole body health that's happening, proactive care that's happening. So yeah, I think it's important to acknowledge the big picture, and care doesn't happen in one setting, one appointment. It is about, do you have a car to get you to your appointments? Do you have food on the table? Is it nutritious? Are you making the right lifestyle choices? And I think this is the challenge that healthcare faces in many ways. And it's going to require these brands not only to lead, but to collaborate because everyone has a stake in patient care delivery.
It seems to me that we are tendency of just the way that we always focusing what's really in front of us. So it's always the same problem. We can't see the big picture. And even if we talk about brains, which are the big picture, right, and brain system and ecosystems, we're still not looking at the entire picture, right? So what I want to segue this conversation from a brand which are relatively systematic in an approach how to heal and healthcare to more of the system of government system without talking about politics, because it's not about that. It is really about transformation of the system that we are. And you mentioned that for a bit, but I really want to spend some time on it because the system are those who encouraging, should say, not bad behaviors, but they encouraging certain behaviors, and they drive decisions, and they drive the brains, and they drive the commerce, etc., all the way down to the kid that you were talking about that may or may not have a turkey.
Yeah, and it's so tricky. It's very tricky because I think there's an ideal world, which I think many in the healthcare industry can see, particularly clinicians, but you still need to operate in an organization that is profitable in order to provide, and so we need to be looking at, again, coming back to collaboration and the way brands work together or communicate about their stakeholders, right? Like right now, there is quite a bit of friction across insurers and healthcare providers, hospitals and health systems. But they are both mission critical to providing care. It has to be paid for. But I think there needs to be increasing focus on, again, putting the patient at the center and valuing patient outcomes versus patient volume. I think right now the financial model, it's volume based. How many patients can we see in a day? What does their insurance cover? We know we'll get reimbursed for that. And often in that calculus, what's lost is time with the patient, relationship with the patient, and at times I think clinicians are limited in what they prescribe, what they're able to do, again, based on, administration that's going to want to ensure reimbursement because we can't be giving away care for free. So again, it's complex, but I think brands need to not get lost in the sauce of the politicization that's happening of healthcare and the financial models. I think from a brand perspective, you really need to focus on the human element. And again, at the end of the day, the objective is to take care of people. And how do we educate those people? And how do we educate the stakeholders in the value of that? What does a path forward look like?
Thank you. Thank you. Just, and I really don't want to put you on a spot, but give me example, give me something tangible. And you don't have to mention the brain. You can frame it different to a frame. You don't have to mention brain. The brain that actually rebuild the trust. Somebody that does something else. Somebody that really we can look and saying, here's the great example. We need more of these. Is there anything like that right now? I mean, to me, it's a little bit hard to see because what you're saying, the healthcare, the industry is really quiet and peaceful. They're operating and a lot of scrutiny of the restrictions and laws and etc. So give me something that's really promising, like a light in the end of the tunnel.
Some of the brands that they've been in these leadership positions for some time now, I think for a reason. But you think of organizations like, Mayo, Cleveland Clinic, Dana-Farber. These are institutions that are known for thought leadership. They are known as innovators that are driving transformation, treating things thought untreatable, laser focused on cancer treatment and cancer therapies. And there's still organizations that need to operate like a business, but they do a very good job of putting the patient first, putting their mission first in terms of providing the highest quality care possible today, but also always striving for solutions to things that we can't solve today. Diseases that, were once thought untreatable and in many cases a death sentence, we're seeing major breakthroughs now coming out of organizations like that. And they do a particularly good job communicating around what they're doing and also what the impact is at a system level and at a human level.
I guess in between is a brand level, right? So just give me a little bit more, give me a little bit more substance. Like what are those? I mean, you're saying following the vision and dedication. Is anything a little bit more of the that you point and say, here's the really kind of what they do is really quite remarkable. Let's give them a credit, Ryan. What I'm trying to do.
I think, again, those ones that I named that I mentioned, the Mayos and Clevelands and Dana-Farbers of the world, I think the biggest and best thing they do from my perspective is they are not so risk averse. They're not so shy about sharing point of
Amazing.
view, progress, challenges. I think there is a level of transparency. It's not unlimited. Some things need to be kept behind the curtain in some cases, but there's a high level of transparency in terms of what are we working on, where have we succeeded, where have we had setbacks, and again, trying to translate that into tangible outcomes, whether that's cost savings, whether that's curing a disease or just saving one individual person. And I think they all do a good job of storytelling at the brand level that spans sort of that macro systemic, the mid-level complex regulatory, all the way down to the very human emotional stories where we can now put a face on the back end of this deep science and research and care delivery. Again, at the end of the rainbow is a person whose life we're saving or changing. And I think those organizations do a very good job with their branding and their storytelling on all of those levels.
So just to continue on this, like most of the brands, they do a lot of research, scientific research, marketing research, any kind of research, all sorts of research, and they're investing a lot of money in research, right? So if we have those institution in a place in the system that is at this point of time in transitional stage, we can't necessarily say that overarching system guiding us toward the right answer. Can we rely on those institutions like a brand as an institution? Can brand pick up some of the role and responsibilities of the institutions? Can we trust the brands to
Yeah.
do that? Especially coming from a healthcare, why would you not say how things really are?
Yeah, and I think, again, kind of coming back to the current climate, where and really a lot of this born out of the pandemic, right? Where vaccines were politicized and what's safe and what data is accurate and what's meaningful and how is research done appropriately. And, and now I believe today we broke the record in the United States for the longest government shutdown. We're starting to have conversations about the FDA grinding to a halt. Again, we have the head of HHS at one point, Tylenol's unsafe. Now it's safe again. I think a lot of the trusted bodies and entities that are meant to govern and guide the health system, I just think there's either a lack of trust or it is very challenging for the average person to decipher fact from fiction and candidly in some cases propaganda. And I think this is where the brands increasingly have an opportunity and really they're beholden to patients as people are increasingly unsure where to look, who to trust. What does data look like? What does science look like? What are facts when it comes to healthcare and health and wellness? I think somebody needs to fill that gap. And I think the brands right now that are proactive in trying to fill that gap and serve as a shepherd for patients, even for providers, even for other stakeholders. I think there's huge opportunity and those that sort of emerge from this transformation and some of the chaos we're dealing with right now, those that emerge as leaders at the brand level are going to be the ones that are proactive, that take on sort of that shepherd role, and again, just remain bipartisan, remain grounded in data, tell human stories. These are the ways to do it, and not sort of diffuse impact at the brand level and get caught up in the chaos, I guess.
So here's the idea, and I'm just going to check possibilities. This could happen, or is this possible to happen, or it should happen? Right now, we're looking at the brands, consumer brands, and we're celebrating luxury brands like choose one, your favorite. We're celebrating brands that are really electrifying the vehicles, choose one, right? Or amazing performance brands like a car brands, choose like a Nike, Adidas, Teslas, and they're celebrated brands for a number of different reasons. We just love those stories. We love those brands or we hate them for a number of reasons, but we are very opinionated by them. Do you think in this time when we are missing so much of data, we're missing so much of the truth, and it's honestly, it's probably one of the most important thing is our mental health, physical health, well-being overall to maintain. Don't you think some of the healthcare brands could pick up that role and be next Tesla, or choose your favorite brand that you Apple, and saying, look at these guys, what they do. They just done this. They make impossible. Adidas saying impossible, like, but here's like a healthcare company that healed the major disease and is going by doing this. Can we follow one of those brands? Do you think there is a chance that's going to happen?
I think, yes, certainly. I think there's a chance. It is such a different market from consumer. It really is one of the most unique markets that exist. And it's interesting as kind of I'm listening to you lay this out. We're seeing this interesting sort of evolution of brands on both ends of the care continuum. I often talk about sort of wellness on the consumer end. This is one end of the spectrum. And then you got traditional sort of clinical hospitals and health systems, pharma, biotech, that more in the weeds traditional. What's interesting is on this end, the wellness end, the consumer end, we're starting to see supplement companies, wearables, and they're wanting to evolve beyond lifestyle brands where, is where they traditionally sat. And they want to differentiate themselves with clinical credibility and scientific rigor and really leaning into trust, right? Because it's such a big flooded market, how do we separate? And I think they're focused on trust, and they want to operate a little bit more like this end of the spectrum. Interestingly, at the same time, this end of the spectrum, which is the patient has just you get what you get on this end of the spectrum, right? You have limited options. They're more focused on regulatory, on profitability, but now they're thinking about sort of the consumerization of healthcare, right? In a world where, I can pick up my phone and Amazon has something on my front door by tomorrow morning, how can this end of healthcare function in a more patient, user experience friendly way? Something that's more akin to a spa than a sterile sort of clinical white room. And it's the sweet spot is probably somewhere in the middle, but it's interesting that the two are reaching towards the middle of that spectrum. And I think the brands that are able to strike that strategic balance, those are the ones that have the best shot, to your point, of sort of emerging as the, de facto leading brands across healthcare. I don't know if it's ever going to be a Tesla, an Apple, maybe. But anyway, yeah, I think there's opportunity, but it's complex and it's certainly incremental progress is good. Nirvana and the top of the mountain are great, but I think another thing that healthcare has to do is celebrate and welcome incremental progress versus just being mired in because we've always done it that way, sort of brand building and communications.
That will be cool to have a hero brand, healthcare brand. I mean, there's a few of them, but have that desire as a consumer brand, that will be amazing. It will be great. Anyways, that's just me rambling. I really want to talk to you about a number of other things, but we have a one that I really want to talk to you about is with the roll-up idea of what would be. And I'm coming kind of building on what we just discussed. What would be the ideal? Let's say that we remove all the restrictions. Let's say that you and me just brainstorm the perfect healthcare system, perfect healthcare company, perfect, what that would be from a business brand and consumer side that really, really works from customer. What is that? You mentioned something last time. I will see if it will come up again, but I really, really want to just give people the most ideal version of healthcare.
Let me start by saying I've been in this space a long time and I love to talk about hypotheticals and what does sort of nirvana look like in healthcare. I want to acknowledge the complexity, the very practical challenges, right? There is a need for practicality in healthcare and to operate within the system we're given because some amount of care is better than no care. That's all of that said, caveat aside. I think in a perfect world, we would almost go back in time in terms of how we approach care delivery. There was a time where your primary care physician knew you, knew your family, came to your house at times. House visits were a thing. They understood your socioeconomic situation, your diet, your mental health, all these contributing factors, which really do add up to, again, whole person health versus you have this disease, this symptom, this thing that we need to treat and then move on. I think if we could get to something like that, that is best case scenario, right? And there's some of it that's happening. Concierge medicine has grown in popularity, but it's really only accessible to the wealthy because it operates outside of the system and is really, much of it is out of pocket. You pay cash. In those concierge settings, you have a doctor that, your primary care doctor is going to spend 2-3 hours with you. In-depth blood work, in-depth discussion versus what does a primary care visit look like for most people? It's maybe 15 or 30 minutes. We focus on, the major concerns, check the blood pressure, and then, we sort of move on and we'll talk to you again in a year. I think directionally that would be a best case scenario. Now, how do you pay for that? How do you scale it? How do you build a business around it? Very challenging. I think things like AI can help, to augment human capital, because that's another very practical challenge, at least to the US. We are facing a major shortage of clinicians, both nurses and doctors, both in the current workforce, but also even the next wave. We're seeing shortages in the universities. So how do you scale that very individualized level of care You need the people and you need some infrastructure and financial model that can support that. And that's where the complexity comes in.
So the simple answer is concierge service will be the ideal, which you have your doctor that really knows you, like I'm, personally. And I do remember some of that in my lifestyle. I have some of that available to me, and you get used to that. But now I'm used to these. But to me, this is the last part of our conversation. I really want to talk about how we scale this up.
Yeah.
And I think that AI could do really, really, really good job at scaling this up, at least at rudimentary level when we need basic questions and the answer take care of like some sort of level of measurement at a daily base. I mean, we have these now, they're passive measurements of our daily routine and healthcare, but we need something that's much more in between doctor and these thing that is like a so arbitrary. Also, I want to just throw another thing. It's like how the healthcare and agentic commerce going to or systems going to evolve altogether. I think it's pretty much same area of the conversation. If you
Yeah, I think going back to, my comment on incremental progress, right? Let's think about incremental progress. And maybe for the purpose of this discussion, let's think about a hospital or a health system setting, right? Where, you may have your primary care doctor, your cardiologist, your oncologist, all your specialties, dermatology, all these clinicians that are responsible for different aspects of your care delivery and outcomes. AI, and a lot of this is starting to happen already. And AI is being applied in that setting at the business level, of course, automating administrative things that are important, maybe don't require human capital. And, now we're giving time back to humans to do the nuanced work of care delivery, to interact, to have the human interactions, right? We're seeing AI deployed at the clinical level, the care delivery level, where, if I have your chart pulled up on my iPad and I'm your primary care doc, for one, AI can analyze your patient record and data set, but then also I can instantly look for evidence-based treatment paths, right? Rather than having to go back to my library after hours and research your condition, your comorbidities, what's been done, AI can now deliver that to me instantly in the room while I'm talking to the patient and empower sort of evidence-based care in a much more efficient way. We're also seeing AI deployed at the communications and marketing level, which is critical, right? If we can't efficiently and actively engage patients, then it is really just incumbent on them to decide, when do I need care? Where do I go? Who do I call? Can I get an appointment next week, or is it going to be 6 months from now? So AI is now helping to triage patients, communicate with them, answer questions, which things that traditionally may have happened in a call center off-site and again required a lot of human capital. So again, these are things that are good in and of themselves, but are also giving time back to our clinicians, to our human care delivery, care workers to really handle the nuanced part of care, and that's sitting in a room with you and me deciding, okay, I know this person better now. And are they going to stay this therapeutic course? Do they have the means, to afford these dietary recommendations? And we can work through some of that more complex part of care delivery versus just saying, here's a prescription for a drug.
I think there is now, after answering this question, I think there is actual chance that we're going to have more of the concierge care and move away from the sick care to value-based care. At least there's a chance for that. Is there anything else that you would like to say, communicate as a really an incredible specialist in healthcare who's looking at the healthcare from outside, basically, and trying to really help?
I think the biggest thing for me to reiterate, and this has always been true, but I think more so in this moment in time, is really just resisting the urge to wait and see. Resist the urge to put your head in the sand and see how these things are going to shake out, or let somebody else be the first to market to say the thing and test the waters. I think there's an understanding that we're in this moment of transformation, and very few, like we are rewriting the playbooks in many ways. And I'm not sure that anyone would claim to have the de facto playbook right now. So whether again it's patients or organizations or doctors, people are looking to peers, to competitors, who is going to rewrite the playbook for us, who's going to sort of lead the way and blaze the path. And I think part of that understanding is that we may not get it entirely right at one time. I think there's this massive fear in healthcare. What if we say the thing and 3 months from now it changes, or we're proven to be wrong? I think that's okay. We should strive to be right more often than not. But I think inaction is dangerous right now. And simply staying the course and trying to ride this out from a brand and communications level, I think that is probably the most dangerous thing that healthcare brands can do right now. And unfortunately, many, have operated that way historically. And because we've always done it that way is a difficult strategy to break from. When, people are self-preservation is important, right? And if I try a thing that's different and it doesn't work out, I might not have a job. That's the other tricky sort of practical part about it. But I do believe those that are proactive right now will emerge as the leaders and come out the other side of this transformation in the best possible position, where those that are passive right now will find themselves playing catch up once things kind of shake out.
Yeah, it is really time to establish new leaders. And I think what you're saying, without me saying that you're saying this is not taking a risk, is probably the largest risk you can take. It's time to move on. I think Ryan, what you're communicating is not just healthcare. I think it's overall business that's really happening in the United States right now.
Yeah,
Everybody
and I
is
mean,
so
whether what
risk
it's
averse.
tariffs, supply chain, I mean, every many industries are facing sort of unprecedented challenges. And I think, one of the biggest is what's going to come next, right? And I think that's part of it, right? Is even if we figure out this thing today, whatever the thing is, next week could be a whole other things. But I think that's where, again, you have to be proactive about contingency planning. Strategy is important, and trying as much as possible to get ahead of things that may happen, I think is more important than ever. You can only be reactive and play catch up on so many issues and so many levels. And there's a lot right now. It's complicated. It's a complicated time.
Yeah, catching up is not fun these days. There's a way too much. Thank you, sir. Ryan, thank you.
Yeah,
This was
thank you. It's
amazing. I learned a ton talking to you, and hearing this again, our conversation again, it's really remarkable. Thank you so much, sir. Thank you.
Yeah, no, thank you. I really enjoyed all of our conversations, this one included. And yeah, and I look forward to hopefully the next one.
Okay. Thank you.